I often joke that if all of my patients breathed through their nose, kept their tongue in the roof of their mouth, and their lips were together, I may not have a job. It's so much easier when the kids are younger to change how they grow rather than when they're teenagers. So over the last 2 years, I've had my second daughter, Vivian, and after she came, we started remodeling our Warsaw office. My goal was to remodel both offices and bring them up to date and move and become a part of this community, and that all happened. It was great. I felt like I was in a routine and I was feeling like everything that I learned from school I was using. And that's when my practice changed. I had a series of classes in California that I went to, and the most important thing probably that I learned was how big of an effect mouth breathing can have on the balance of someone's face. When kids are 2, 3, 4 years old, they're already starting to show their growth direction, and effects of mouth breathing and tongue position are already starting to appear and changing how these kids grow. And it's so much easier when they're younger to mold them and change their growth trajectory rather than when they're older and trying to turn back time. There was no denying what was presented to me. And so then when I came back, I couldn't look at things as I had before. I met Lori, my myofunctional therapist, and we started to figure out what I was going to do with the new information that I learned. And that's how we got started with changing how we do things.
Orofacial myofunctional therapy, in essence, is neuromuscular re-education. Okay. We've got a lot of musculature here, but essentially I'll boil it down and make it simple. Lips, cheeks, the tongue, which is front and center, and that tongue has to live. This is the mouth, the intraoral air cavity is the house of the mouth. So, back just 300 to 500 years, food wasn't available in a pouch or a box or a bag. And that has had profound changes in terms of how we see our children eating today. I have 3 and 4 and 5-year-olds that I see in this practice that you couldn't get them to chew something. We don't live a lifestyle anymore where we are outside nursing until 2 to 3 years of age, and gradually, introduced to foods by gnawing on foods. They're just activating that musculature. That's tongue movement. That's all sorts of movement, and they develop differently. My passion is really, and it's really kind of my roots, what can we do to offset? What can we do to prevent? That's where we're at here.
Once things, I guess, philosophically changed, I started actually reaching people. One family comes from 2 hours away because there just isn't anyone around them that does or practices the way that we do.
At first, I was very apprehensive. Myofunctional therapy, what's that? And I'm thinking, braces is gonna fix all this, right? And Dr. Watson said, sure, braces will fix it. And then it'll go right back to the way it was because his tongue was pushing his teeth and changing his teeth.
When Dr. Watson looked at my children, she agreed they were deficient in jaw growth. And so that's the journey that we started on. We can't just focus on straightening teeth. We have to actually change structure.
We're getting there. We can actually see change instead of just moving and shifting and, baby teeth and adult teeth and all these things. It's finally coming together.
In the last year and a half, it's just been huge of what my daughter has changed. Her confidence has grown. She's in the braces phase, but it's just been an eye-opening, encouraging, wonderful experience.
Just hearing over and over again these stories of families, it's life-changing. We're making a difference in people's lives. If you learn something new and it helps patients, and improves their quality of life, then we have to do that for them.